welcome to today's class. Today we're going to discuss Principal Investigator Oversight and the appropriate delegation of tasks. And I've been in the industry now for well over 17 years, worked as a study coordinator at a large university in California, and I've also been a CRA for both pharmaceutical companies, device companies, and CRO companies. And I've also worked most recently in the last 5 years as an auditor for both sponsors, pharmaceutical companies, device, sites, and also on behalf of CROs. I've worked in auditing in terms of just doing quality assurance, and then also in terms of preparing for FDA audits, and then also helping with developing corrective and preventative action plans following FDA audits. I've also worked as a project manager, a director of clinical operations, and the last 3 years I've been doing quite a bit of training with Barnett. I'm just very, very passionate about education in terms of understanding why we have to do all the things we do. So why we have to check those boxes, why we need to have up-to-date CVs, why does that all matter? So throughout this presentation, I'll try to bring in some practical examples for you. I'll refer quite a bit to the regulations, but my main theory or belief is that you don't have to have things memorized, but you do need to know where to look them up is really the key. And you need to know just what is the intent behind the regulations, because they're often very vague, and we run into situations all the time that we can't just look up what to do in that scenario. So if we can understand the intention behind the regulations, I think we're in very good shape. So in today's class, we'll be discussing the regulatory requirements and guidance regarding adequate investigator oversight and appropriate delegation of study tasks. We'll review documentation requirements and determine strategies for appropriate delegation. Our objectives for today are to recognize the industry concerns about adequate delegation and improper delegation of study activities, identify documentation requirements for proper delegation and investigator oversight, and identify strategies for determining role assignments specific to a study project and requirements of PI oversight. A lot of what we're going to talk about today looks like very common sense. When you see it on the slides, you're going to think, I know that. I've heard that before. That's not new information. But the very simple fact is that investigator oversight continues to be one of the top findings in FDA audits, in EMA audits, as well as sponsor audits or even internal organizational audits. Just the breakdown in communication, and where really the source of a lot of these findings comes from is the delegation log itself. And again, it seems very straightforward to fill out this piece of paper, to write people's names on it. But what we often forget is to link it back to their CVs, to education, training, and experience, to link it to current dates, and then to realize that it is a living document throughout the study. And anytime somebody takes on a new role or performs a new task, we need to see that they also have training in that task for the study. So we'll come back to that several times throughout today's presentation. But this is really going back a number of years. So in 2006, we had the initiative to modernize the regulations of clinical trials, including the BIMO inspections program. And we'll review some slides on that, and we'll talk a little bit about what does that mean in terms of this program. And what it really comes down to is how the FDA audits and what they're looking for. And we'll also refer back to some other information in terms of investigator regulatory the inspections guidance on what the investigators or the inspectors that work with the FDA are actually looking at and how that comes into play. The reason we're doing this today, too, is because with these inspections and other assessments, our goal is to really build quality into the clinical trial up front, rather than assessing it at trial completion. And where we're really seeing this come into play within the last 2 years is the new guidance on risk-based monitoring that has come out in the U.S., and then followed very closely behind by the European Medicines Agency, again, the EMA, also went ahead and issued their final guidance document last year on quality risk management. There's that word again with quality. But the concept is the same.